everyone for being here. Thank you, Kristen, for that wonderful introduction. I'm Briani. I'll share my screen. But for my master's project, I chose to create a postpartum resource guide for New York City parents, and I created it with a reproductive justice and postpartum depression lens. I had the honor and privilege of working with Kristen Eflin and Erica Livingston as my committee members. Can everyone see the next slide?
Yes.
Okay, awesome, cool, it's working. All right, great. When I first began thinking about what I wanted to do for my master's project, I knew that I wanted to create something practical. And the more that I thought about it and talked it over with my fellow MCHS colleagues and Professor Fenn, I knew that I wanted to create a resource guide that would in some way, shape, or form address the prevalence of postpartum depression. As a doula, I've witnessed how hard and intense the postpartum period can be for parents, especially in those early days, weeks, and months. And unfortunately, my individual work as a doula is not enough, especially considering that not every parent is able to have a doula. There needs to be systems put in place to make sure that parents are cared for when they get home with their newborn. So according to the CDC, 1 in 5 birthing people face postpartum depression. And as expressed by the World Health Organization, the postpartum period is an underserved part of maternal health. So my hope in this project was that I could begin to start addressing the prevalence of postpartum depression, because it not only affects birthing people, but it also has effects on their children as well. My specific aims for this project were to research the risk factors for postpartum depression and examine existing proposed solutions for preventing postpartum depression, to create a screening tool for resources to determine if they are appropriate, to survey birth workers to guide the screening process and resource collection efforts in order to achieve a consensus concerning various resources to include. Additionally, to analyze the resources submitted by birth workers and attempt to address any gaps in the provided resources. And finally, create a resource guide and publish it as a website and or a Google document. So for my literature review, I decided to break it up into 5 different segments. First, it was very important for me to understand what postpartum depression is. I wanted to gain a deep understanding and what it means, what it entails, and what it looks like. Next, I wanted to learn more about the demographic data surrounding postpartum depression. It's important for me to understand who is affected by it. Are there any people groups that are more affected than others? And just kind of more of the demographic information around it. Next, I wanted to learn about the risk factors for postpartum depression. What are the things that is causing such a high prevalence rate? What are the risk factors involved in leading to someone having postpartum depression? Next, in order to understand how to combat these risk factors, I wanted to know what preventative measures are out there. And finally, it was very, very important to me that this project be grounded in reproductive justice. So I wanted to understand what is the intersection between reproductive justice and postpartum depression, and how do I apply reproductive justice in addressing postpartum depression? So in order to find out all of this information, I gathered information from PubMed, Google Scholar, as well as the references from some of the initial articles that I found. So I'm not expecting anyone to read this slide. It's a lot of information, but this is just to give you a glimpse of the search terms that I used for PubMed. I primarily used their MESH database, which is just for medical subheadings. More generally speaking, for Google Scholar, I use terms such as postpartum depression and social support, postpartum depression and reproductive justice, postpartum depression risk factors, preventative methods, and so on. So from that literature review, there was a lot of really interesting information. For starters, I learned that some of the major risk factors of postpartum depression are lack of social support, history of depression, whether that be depression during pregnancy or prior to pregnancy, as well as poor relationship with the birthing person's partner. Another interesting finding that I came across was that these risk factors and preventative methods were classified as biological or psychosocial and sometimes even psychological, although often the psychosocial and psychological risk factors were used interchangeably. Social support played a very, very large role in what I found. So I found that both the lack of support and having adequate support played a big role in whether or not someone had postpartum depression, where the lack of social support is a risk factor, but having social support can actually be a protective effect against postpartum depression. In addition to social support being a preventative measure, also cognitive behavioral therapy was another method that was also found helpful. Interestingly enough, there weren't many scholarly articles surrounding the intersection of postpartum depression and reproductive justice. I did manage to find some really good literature, but in terms of quantity, I wasn't finding a whole lot. So what did I do? Just to give you a general understanding of my methods, I conducted a selective narrative review, which we just discussed. I created a screening tool to navigate the kind of resources that I then requested from birth workers. So I surveyed birth workers for postpartum resources that their clients have found helpful. Next, I filled in any gaps in the resource categories, which I'll explain more about in a minute. And then I used the screening tool to sort through submitted and researched resources, and finally created an open source resource guide using Google Docs. So as I mentioned, reproductive justice was really at the forefront of how I wanted to create this project. So I wanted to share with you all a quote from one of the pieces of literature that I found, and it states, "Structural and obstetric racism directly threaten patient-centered access to perinatal and reproductive health through inequitable practices and policies, as evident in the treatment, access, and experiences of Black people seeking to avoid or terminate pregnancy, to establish and sustain a pregnancy, to birth and or to parent, with lives affected by stressors, including housing instability, mental health challenges, and substance use." So I wanted to highlight this particular quote because for me, it really just drives home the importance of access and how strongly racism inhibits that. So my hope was that this project would be a tool to increase access and provide resources for folks who might not have been able to get them otherwise. So I used my understanding of reproductive justice to guide my creation of this screening tool. So the criterion of my screening tool were, if a mission or purpose statement is provided, does it include a dedication to systemic change or reproductive justice or accessibility? And as I used the screening tool, I found myself morphing this criteria just a little bit, in that I was really looking to see anywhere on the website of the resource, is there any mention to systemic change or reproductive justice or anti-oppression or anti-racism or accessibility? So not just in the mission or purpose statement, but it might be in the values, but just does it exist in in the resources representation of themselves? Next, I wanted to know, or it was important to me to find out if the provider or resource offered a sliding scale or support for people who have a low income. Does the resource or provider engage with community stakeholders? And this particular criteria gets at another really impactful statement from that same article about how it's important to value community knowledge just as much as we value medical knowledge and other authoritative figures out there, and that the community knowledge has value and should be upheld. So I wanted to know if the resources and the people providing these resources value the communities that they serve and the knowledge that they have. Next, does the resource or provider offer services within all 5 boroughs? And if not, is there a virtual option? Is the resource accessible via public transportation? Does the website materials and marketing use gender inclusive language? And lastly, does the resource and provider accept insurance and or Medicaid? Okay, so before I get into the survey, the results of the survey, I want to show you what it looks like. So I'm going to do a new share. Hopefully my internet will cooperate. Okay, can everyone see this?
Yes, I can see it.
Okay, awesome, thank you. So when I reached out to birth workers, I created the survey and I made sure to let the folks who are responding know that this was a reproductive justice centric project. So I asked for resources that were accessible, that were inclusive, that were culturally appropriate. I asked for people to, if possible, tell me the location and cost and when someone might want to use this resource in their parenting journey. And if possible, tell the target population. So I also asked for some more general information about the respondent, such as their role or connection to gestational parents, the number of years in their field, their gender, the name of the organization they either own or are affiliated with, if there is one, their race and ethnicity, and their email address. So into the nitty-gritty of the resources. More broadly, I asked folks to just reflect on their experiences with working with birthing people and ask, what are the resources that their clients have found helpful? And then I further went to get into a little bit more detail, and these specific categories went on to inform the way that I formatted the guide. So I asked people, what are some resources that people can use to prepare prenatally for the postpartum period? What are some postpartum support groups that they might find helpful? Resources for postpartum mental health services or postpartum centric therapists. Resources for support with housing, food, and clothing. Resources for support with intimate partner violence. Resources for support for lactation. And finally, resources for support for parenting classes. So, okay, so in terms of who I surveyed, the survey was shared with a doula Facebook group consisting of over 2,000 members, the Ancient Song Doula Services Network consisting of over 350 members, 2 WhatsApp groups, one with 9 members, one with 39 members, the Just Birth Space team of 11 members, and then I also shared it with my fellow MCHS colleagues. In total, I received 5 responses. 4 respondents were doulas and 1 person was a midwife. Most of the resources provided through the survey were virtual. I did receive some additional resources via email, which were really helpful. Some of them were resource lists that other doulas had created. In terms of what resources didn't receive or which categories didn't receive as much resources, the category parenting classes only had a couple of resources in there, as well as housing, clothing, and food. So by the end of it, between my own research and the resources submitted, there were over 80 resources, which is a lot to sort through. So to make my life a little easier, I created a sorting tool. So I'll share with you all what that looks like. Okay. So what I did essentially was I had the title of the resource category that it fell in, the name of the resource, where it was located, the cost, and then each of these columns here refer to one of those selection criteria. So I use this as a way to also help me figure out if the resources should be included in the resource guide. Okay. For any categories that had less than 5 resources, I did a Google search to fill in the gap. For more interpersonal or direct service related resources, I tended to focus on organizations that either had a clear mention of reproductive justice or something similar on their website, or at the very least had people of color on their team. More often than not, if that was not the case, they were not included in the guide. For resources such as like mealtrain.com, which is a website tool, I didn't really go too heavily on things of that nature because they weren't person-to-person contact. Many of the resources did not make mention as to whether or not they engaged with the community stakeholders. So I didn't really get to rely on that criterion as much just because that information just wasn't present. And it didn't feel fair to automatically exclude something just because it doesn't say it, because they may be doing the work and just not publicizing it. And because there were so many of them that just didn't really mention it, I kind of just had to make the decision to not focus on that criterion as much. Okay, so the moment you all have been waiting for. What did I produce? So I am going to share the guide with you. This was very much a labor of love, and I am very happy that it exists. Okay, so this is the New York City Postpartum Resource Guide. My goal is to update it quarterly. I have a table of contents that is clickable. So if we go to the first one, so I decided to start with prenatal preparation for postpartum because, and just in terms of like the time span of someone's postpartum journey, this would probably happen first. So I started the guide with that, and then everything else was just no really specific order. For this particular category, I believe there were 8 resources. For each resource, I put the name of the provider or the organization, and it's also clickable, and the person can just click on the link. Included the price, more generally what the resource is. So for example, this one is a 2-hour class. And then I made mention if the resource said anything about reproductive justice or accessibility. In cases where the resource used binary language, I made mention of that as well. And yeah, this is the guide. It was very fun to make and very interesting to see the wealth of resources in the city. And I really hope that this would be helpful for folks. The category that had the most resources was mental health support. There were 16 resources in this section. They ranged from hotlines to support for people who have had infant loss or abortion. And it's just a huge range of resources that folks can use if they need mental health support. The next category that I had was infant feeding and lactation support, which ranged from support groups to access to lactation consultants. And some of them are also websites such as Yummy Mummy or Kelly Mom, or Facebook groups. The next section was postpartum support groups. And this ranged from supporting parents who, for like for single parents, for trans parents, for non-binary parents. So it ranged across the entire spectrum. I wanted to make sure that when folks looked at this guide that they saw themselves. So I tried to be as diverse as possible in the resources. Okay. Okay, so that's the guide in a nutshell. So this project for me really highlighted the lack of attention that is given to the postpartum period. It's really interesting because if I'm not mistaken, in I believe 2018, the American College of Obstetricians and Gynecologists suggested that providers create a postpartum plan with their patients. I've asked a few of my clients if their provider has done that, and they all said no. So it's evident that there isn't really much happening on the medical side in terms of making sure that when parents come home that they have the resources they need and are cared for. So my hope was that this project will begin to bridge the gap in the lack of continuity of care across the maternal health spectrum. So one of the strengths of this project is that many of the resources were virtual, free, or provided at a sliding scale fee, which I was very, very happy about. My hope was that this would be as accessible as possible, especially in terms of cost, because not everyone can afford to have a postpartum doula. Luckily, there are organizations that do provide postpartum doula services. Which reminds me, another thing I forgot to mention, I kind of towards the end of creating the guide, I decided to also include postpartum doula. So this wasn't a category that was in the survey. So this one specifically was just from my own research. A limitation of this project is that it is only accessible to English speakers with access to the internet. Okay, so my recommendations for future research. While I did find a lot of literature that emphasized the need for social support, very few actually detailed what that means. So I'm very eager to learn what constitutes as social support. What does that look like? How does it differ across different demographics? I think that there needs to be more research done on what social support means and what it entails. Additionally, I want to know more about the impact of prenatal preparation for the postpartum period. Even when ACOG submitted that recommendation, they only referenced one paper. So I'm curious to learn what impact it can have, and if there are people who are actually doing it, and if things change as a result of actually preparing for postpartum prenatally. And finally, I think that there needs to be more scholarly research surrounding the intersection of reproductive justice and postpartum depression. It's really interesting to me that with all of the literature that I found surrounding preventative measures for postpartum depression, there wasn't really anything related to reproductive justice. And I honestly feel that in order to fully support people in postpartum and to address the prevalence of postpartum depression, reproductive justice needs to be at the center. And I know people are doing the work because I'm doing the work and other folks that I know are doing the work. So why doesn't the literature show that? So those are my recommendations for future research. In terms of next steps, I hope to create a website to house a resource guide. That is one of my specific aims that unfortunately I did not have the capacity to fulfill. So that is one of my next steps. And then I also plan to continue disseminating guides to other birth workers. And if possible, it would be great to also have it be translated into Spanish or another language just to make it even more accessible. These are some of my references. Shout out to the websites that let me use their images. And lastly, I would like to thank, first I'd like to thank God, because Lord knows I could not have done this project without his strength. I would like to thank Kristen, and Erica for their amazing support. Kristen, I thank you so much for working with me and for being with me along this journey, for pushing me, for holding me accountable. It's been such an amazing process, and I can't thank you enough. Erica, you are the catalyst for why I'm so passionate about postpartum support. So I thank you. And now I'm getting emotional. I like to thank my MCHS cohort. Y'all are amazing. I'm so appreciative of the community we've created together. And I'm excited for the work that y'all are going to do. To everyone who supported this project, whether you filled out a survey, whether you sent me a word of encouragement, thank you. To Ancient Song and Just Birth Space, thank you for being the amazing organizations that you are. Finally, to my mom and to my partner, I love y'all. Thank you for being my rock and for always encouraging me, and for whenever I was in a rut, getting me out of it and reminding me that this is important to me and to keep going. Thank you all for being here, for listening, and for being here to support our presentations. Thank you so much. Any questions?
I have a question, Briani. Thank you for that beautiful and just eloquent acknowledgement. So one of the things you mentioned were those areas where that you got limited resources, and parenting was one, I believe housing was another. Can you talk a little bit about what you just why you think that there were those big holes in those particular areas, particularly parenting? That stood out for me. And just your thoughts about that.
Yeah, I would say off top of head, parenting classes was the last question in the survey. It's possible some people just didn't make it that far in, which is a real place. And I think, honestly, I don't know if that's just something that people really think about when it comes to the postpartum period. I think that oftentimes the focus is lactation, which is important. But I feel that not very many people think about the other aspects of it, such as, how am I going to have some place to live? Do I have food on my table? How the heck do I parent this tiny human that just came out of my body? So I think part of it is reframing the narrative to change the lens of postpartum. And the people that I work with, we often say that postpartum is forever. And I think by having that mentality, it gives space for more of these kinds of resources, right? Because if you think about postpartum as like the rest of your life, once you're a parent, you're in postpartum, then it's like, it makes sense that you might need parenting classes. It makes sense that you might need other social resources. So I think just reframing the idea of what postpartum means.
Such good work, Briani. I just am so grateful that you can be able to send this out to folks. I know you already have been, and I hope it keeps getting shared widely. Yeah. One question I have is,
sorry, Kristen, there is a question about, you said it, distribution, dissemination from.
Oh yeah, we'll let her answer that too.
Yeah, go ahead. Sorry.
Okay. So basically the way that I am planning on disseminating this guide is to all those people who I submitted the survey to, they're getting it. So I'm definitely putting it onto that doula Facebook group, to my Ancient Song community, to my Just Birth Space team. I had the pleasure last week while I was at a birth, I gave it to the midwife that I was working with. So some of it is going to be kind of like more grassroots, word of mouth. But to any pregnant person that I know, I'm sending it to them. I'm asking people to share it on their social media to share with their clients. I have the pleasure of mentoring some newer doulas with an ancient song, so I share it with them. But that's essentially what it looks like, is just sharing it out to the birth workers that I work with and asking them to share it with their networks as well.
And are you wanting to share the Google document link?
Oh, yeah.
Yeah.
Yes.
You
Yes.
can, you can do that in the chat when you have a minute. I know you're trying to do 5 things at once, but yeah, you can.
I want to just make sure that the Dr. Del Villar's ideas got in here in
Yes.
her chat question. She asked, do you think there might be ways to make this available to local government or city websites or other social justice NGOs?
Ooh,
Yeah.
I'm sure there is. I don't know how to do it, but someone does. Yeah, that would be amazing. I'd love to do that. I think it might look more so like reaching out to the health department for starters, and sharing it with them. Yeah, that's the first thing that pops into my mind, is sharing it with the Department of Health. And of course, their reach is much larger than mine is. So they'd be able to share it with other folks as well.
We have another alum in New York City too, and I'll if you don't already know each other, I'll make sure, because I know she works with a lot of folks doing MCH stuff too. Yeah. Yeah. I was wondering about that process. I know you said it was really limited for, you know, housing and clothing. Yeah, what that was like. And I wonder if you think it might have a little bit to do with the pandemic, that so many resources were virtual and that you had a harder time getting those in-person resources.
Yeah, it was interesting. I think I found maybe 5 organizations that supplied housing. I think 5 for each, so like 5 for housing, 5 for food, and 5 for clothing. And even then, some of them were like places that you had to buy the clothes. It wasn't like a donation center. I did come across this really cool website that I think like had like 30 resources on where to find clothing, and I believe food as well. But it really just took a really intense Google search and reaching out to folks. Some of the things I already knew existed because I'd referred them to clients previously, but I do think the pandemic is definitely a part of it. Folks just don't have the capacity that they once had, but there are still organizations that are donating. So it's just a matter of just finding them and reaching out to folks and seeing what's around.
Any other lingering questions? Well, oh, go ahead.
I can't help myself. So, Briani, you said one of your limitations was that your guide is only going to be accessible to people who have access to the internet. Have you potentially explored, you know, opportunities of creating a brochure or anything that you could disseminate? You know, perhaps you could apply for a grant for funding to create this resource and maybe update it on a yearly basis. Would that be something that you could consider as one of your next steps?
Yeah, so actually, Erica Livingston, one of my committee members, is currently working with the Brooklyn Public Library to do a maternal health, like it's called Journey to Parenthood. And if I'm not mistaken, as a part of that, they are creating like a hard copy thing. And when I first started this project, she mentioned maybe potentially including the guide in that. So that might happen. It would be great if it could. So that's right now is at the forefront of how my hope is to have a physical copy of this guide that will exist in the public library for folks to use it at their disposal. Additionally, another thing that I do want to change in terms of the formatting is for the hotlines, putting the phone number on the page so that folks don't have to click it, just to take away that barrier. And so if someone sees it, they can just automatically just get the phone number without having to go through too many pages to have access to it. But yes, that is the plan.
That sounds awesome, Briani, and it would be an amazing recognition of all the work you've poured into this project. Congratulations on a great presentation and a wonderful project.
Thank you.
And one thing to remember is even though it is currently only accessible on the internet, it can be downloaded as a PDF.
Yep.
And, you know, my clients who haven't had internet access, a lot of times they would have like a smartphone that as long as they could get on someone else's Wi-Fi, they could download something. And so, you know, they still have to take that extra step, obviously, or go to the library, but it is downloadable at least. Yeah. All right. Any more questions for Briani? Such good work. So excited, you know, that
Also,
you're gonna be
my mom is
graduating.
here.
Yeah.
I know Professor Tylo, we wanna bring up those parents. So Mama Bear, thank you for everything.
Yes, what's your mom's name? So we
Kim
can,
Weber. She's gonna kill me for shouting her out.
oh. Miss Tina, thank you for your daughter. She
Kim
is
Weber
awesome.
and Tina is my partner's mom. So both my moms are here.